Bismillah, Alhamdulillah, wassalatu wassalamu ala Rasulillah. Allah subhanahu wa ta'ala, He tells us in the Quran, who has created the seven heavens, one above another. You see no fault in the creation of the most beneficent. Then look again, do you see any rifts? Allah subhanahu wa ta'ala is challenging human beings to look at the creation of Allah subhanahu wa ta'ala, and He asks you, do you see any faults? Do you see any inconsistencies? Do you see any gaps in the creation of Allah subhanahu wa ta'ala? And then again in the following ayah, in Surah Al-Mulk, he goes from ayah 3 to 4. He says, then look again, and yet again your sight will return to you in a state of humiliation and worn out every single time you look at the creation of Allah subhanahu wa ta'ala to try to challenge the creation of Allah subhanahu wa ta'ala. Now, the regularity of the creation of Allah subhanahu wa ta'ala, the consistency of the creation of Allah subhanahu wa ta'ala allows us to function, allows us to exist. If there was no regularity in the creation of Allah subhanahu wa ta'ala, we could not study it. And thereby, we could not ascertain patterns in the creation of Allah subhanahu wa ta'ala. There would be no such thing as science if there was not a consistency in the creation of Allah subhanahu wa ta'ala. And so one would say, well, what about death? What about destruction? What about pandemics? Part of the consistency of the creation of Allah subhanahu wa ta'ala is that everything has a beginning and everything has an end. Because we look at things in a very simplistic way. We would say that the best and most reliable cars that are coming off the production line are the ones that are made consistently. So if they're made consistently, all the parts will fit. We know what to expect. We know that the tires will fit. We know that the alternator for all the same vehicles is going to be the same. There's going to be that level of consistency. We know they should be consistent in passing safety regulations. And so we look at it in a very, very simplistic way. But again, we don't look at it sometimes in a complete way, because those cars have a beginning. Those cars have an end. Those cars aren't flawless. Even though they pass a safety inspection, there may be a recall. And so what we have to appreciate is that trials and tribulations, a beginning and end, death and destruction are a reality of creation. Allah subhanahu wa ta'ala, He tells us in Surah Al-Mu'minun, ayah 30, when He talks about the flood that occurred to the people of Nuh alayhi salam, He says, they are indeed signs for people of understanding. For sure, we are always putting people to the test. We are always testing people. So this is a consistency. This is a reality. This is a consistent reality of creation. Because it would be inconsistent if Allah would let some people live forever and others would have a beginning and end. Or others would have, everyone needs to have a beginning, but He would let others maybe live forever. And He would have some people that, they would die. Or you have nations that would be untouched with calamity. And if we recall the previous podcast, the brother, the sheikh, he was mentioning how Allah subhanahu wa ta'ala, He likes to see His attributes in the creation. Obviously, it's not on the same level, but we see a humanized version of those attributes. So if Ibn al-Qayyim says that Allah subhanahu wa ta'ala is compassionate and He loves those who are compassionate. He is merciful to His servants, and He shows compassion to them. So He wants His servants to be merciful and compassionate to one another. This is a praiseworthy trait. And if we look at the creation of Allah subhanahu wa ta'ala, the consistency in what Allah has created for us to even exist, we realize that consistency is a praiseworthy trait. We realize that consistency in our character, being steadfast, being patient upon the truth, is something that is praiseworthy, is something that we should all strive and struggle to attain. And this is why the hadith of Rasul Sallallahu Alaihi Wasallam, he states that the most beloved actions to Allah Subhanahu wa Ta'ala are the ones that are done consistently, even though they are small. They are the ones that are done consistently, even though they are small, because then what does that mean? What does that mean? That means you do things based on principle. That means you do things based upon the truth. That means you do things based on what is just and not necessarily on your emotional state, because your emotional state can fluctuate very, very easily. It's very easy for your emotions, even within a day, within an hour, to fluctuate, to go from happiness to sadness, to laughter, to joy. You can see those emotions sometimes when people watch a movie. They go through this emotional roller coaster. So if we base our actions purely on emotion, then we are not being just to ourselves. We are not necessarily being just to others. If we are doing things based on emotion, then it doesn't mean necessarily that we are doing things based on the truth or principle. It may coincide with that, and that's why they say that a broken clock is right at least twice in a day. So it can coincide with that, right? So you could do something emotionally. You're feeling a lot of compassion towards your fellow human being. Let me be giving to them. Let me give them a face mask. Let me sanitize myself. Let me do social distancing. Let me see if my neighbor needs something, because I'm feeling very compassionate at that moment. I'm feeling very, very merciful at that moment. But then maybe when you're touched with some stress and anxiety, when you're touched with some selfishness, can you be consistent with your good deeds? Can you be consistent? For a Muslim to be truly successful, it demands that you are consistent upon the truth. Your salah isn't 3 times a day one day, 4 times a day the next day, 0 the other day. It's commanded upon you to do salah 5 times a day. To be consistent upon the salah 5 times a day. It's required that you're consistent upon not associating partners with Allah subhanahu wa ta'ala. We are commanded to not oppress people, not occasionally, but consistently. And so we find ourselves right now within this pandemic, we find ourselves in a stage where we're trying to be consistent with social distancing, with many measures. We're trying to be consistent upon acting collectively to benefit the collective. So not acting individually, but acting collectively, okay, thinking about the collective. And so there is a pull, there is a temptation, there's an emotional pull, because everybody's situation is different. Some people during this pandemic, this lockdown, they're losing more money than others. Others are itching to get going. Their businesses are suffering. So everybody is on a different stage. But can we be consistent on this at this time, at this juncture, for not ourselves, not for our emotional needs, but for something that we can principally say is important, that we can go to the truth and say that being compassionate to others, being merciful to others, being just to others is something that we should do consistently. Because guess what? Part of the consistency of Allah subhanahu wa ta'ala is He is always putting us to the test. And our test at this point in the pandemic will be different than our test yesterday. And our test yesterday will be different than the test that we'll be facing tomorrow. But that's just as consistent as the test itself, that we will be put within a test, but the consistency is that test will be different for everyone at different time periods. So today I would like, moving forward, I want to introduce our next guest, Dr. Ammad. I have known the brother for many years, close friends. We have worked many years in the past in Dawah, in community work, and he is currently a doctor practicing in the epicenter of the United States right now. So New York right now is the epicenter of the pandemic within the United States. And I think his experience is going to be invaluable. I think what he will share with us will be invaluable. And so I would like to welcome to the podcast our dear brother, Dr. Ammad. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the podcast, brother.
Assalamu alaikum, Dr. Syed. How are you doing?
Alhamdulillah, I'm doing very well. It's good to see you again. Not too many opportunities to see you face to face, so this is an added benefit for myself. And you're right now in a very unique place and time, not only now but probably in human history. When we look back at it, this pandemic is something for the history books. This is like going to be a chapter that people are going to study in medical textbooks, in history textbooks. So you're in a very, very unique position right now. And this morning, I actually watched a press briefing by the governor of your state, Andrew Cuomo, and he was updating on some statistics. So he was updating the people and the press on some statistics. So from what he says, even though you are at the epicenter, you're dealing with a phenomenal amount of cases. He says that the total hospitalization has actually decreased at this point. And he's mentioned that even though you've had a high number of deaths every day, it has now started to decrease. As of April 17th, there was 540 deaths. Hospitalizations per day are still at pretty high level, but they are lower from its height. So you're looking at about 2,000 hospitalizations per day. Is this what you're seeing on the ground? Is this your reality that you are also witnessing on the ground, that things were crazy but are starting now to get better?
Yeah, alhamdulillah. So it's actually there was what we would call a peak. I felt like maybe about a week ago, and you could actually feel it with the amount of patients inside the hospital and the way things are going. Now it's not much better. So let's say if that was a peak and that was a 10 out of 10 in severity, we're maybe at like a 9 out of 10 realistically. So it's okay. It hasn't gotten worse, but it definitely hasn't gotten significantly better. But overall, in terms of numbers, we are headed in the right direction.
Okay. So another statistic that he shared is that with the social distancing measures, with essentially New York being put on pause, and with the use of face masks in public, there is a reduction in the infection rate. So they're seeing that, but it's so small. Like prior to this reduction, they were at about 1.4. So 1.1 person on average would infect 1.4 people. Now they're saying it's 0.9. So the reduction is still almost like one person. One person is still infecting one person. So, there is still a pretty decent infection rate. So do you feel that what is it just taking time for these measures to have more of an effect? Or do you feel that not enough people are wholeheartedly implementing these measures?
I think it's a little bit of both. I think the fact that we've seen the slowdown definitely has to do with social distancing. I don't think that's. I think it's the connection's fairly obvious because we are seeing a slower number of admissions to the hospital. The number of deaths are staying the same, but those are people that have been hospitalized for maybe 15, 16, 17 days. So along with that, there's also been a change in the way they're reporting the number of deaths. Before they were reporting deaths as coronavirus confirmed deaths, we would do a test in the hospital, it would come back positive, and then if they passed away, then there was a confirmed death. Now what they started including was coronavirus related or coronavirus associated deaths. So maybe somebody
Yeah.
passed away at home, or maybe people pass away in nursing homes. I think they weren't including those before either.
Okay.
So because what happens is in a lot of people nursing homes are do not resuscitate, do not intubate, do not hospitalize. They've made a decision
Okay.
for their end of life to be not to go through those processes. So if they develop a pneumonia, but you're not going to do a testing for it, how do you know with 100% coronavirus pneumonia? But let's say
Yes.
now 8 people on the same floor have it. Well, it's very likely a corona. So I think they started including those numbers as well. That's why the numbers continue to seem to go up. But I think in terms of the admissions, I can tell you. So I just finished a shift maybe about 6 hours ago in the ICU. So I can tell you that we didn't have any new admissions that I did overnight, which is the first night that's happened.
Oh,
But
okay.
that doesn't mean that we didn't have a bunch of things happen otherwise in the hospital.
Yeah. Like, what are some of like the big things that you're dealing with that causes everyone's attention to be drawn to?
So the biggest thing is always like something like a code blue.
Okay.
Right, that happens a lot. So earlier in the week, 2 weeks ago, they were happening on a very regular interval basis, like every hour they were happening. Or sometimes it's like unusual. We have a joke in medicine, things that happen in clusters. So you'd get like 4 back to back and nothing for 2, 3 hours. But there was a
Yeah.
consistent amount happening every night. So that's what they're happening a little bit less. I think we're getting a little bit better at managing. I mean, somewhat managing the disease. The truth of the matter is what nobody will tell you in the media, or nobody I feel like has been clear about, is that we really don't have a treatment or management for this. All what we're doing is called supportive
Mm.
care medicine, right? And what supportive care is we're supporting the blood pressure if the blood pressure is low. We're supporting the
Mm.
lungs if the person's unable to breathe. We're supporting the heart with more medications. We're supporting the kidneys with dialysis, and we're letting the body's own immune system actually take care of the virus. The
Mm.
issue with that is that if someone has an immune system that's not strong, I mean, they're unable to the body's not unable to handle the virus, and people end up going into multi-organ dysfunction and passing away. But the that's kind of what we're seeing inside the hospital, and all these trials that you hear about hydroxychloroquine, azithromycin,
Yeah.
the IL-6 inhibitors, none of that has been proven in any placebo trial to be effective.
Have you used that at all? Are people
Oh
using
yeah,
that?
we use that here. I'm sorry to interrupt, but yeah, we use that here. This is like a regular protocol. But the
Yeah.
amazing thing is that it's not proven to be of any benefit.
So are you're not seeing even anecdotally any benefit?
I mean, I don't know. I mean, I think you can't even tell some like the same person with the same characteristics, let's say roughly the same amount of
Yeah.
years old, the same comorbidities, will come in, will give them the exact same treatment, and one will pass away and one will survive. So is it
Yeah.
really the medication, or would they have gotten better despite the medication? You know
Yeah,
what I'm trying
because
to say?
they've been touting the study out of France where they treated 1,000 patients and there was some type of benefit with this treatment protocol. Uh, but it's true, there's no consistent studies, or at this point, you can't even do a peer-reviewed study, right? Like,
Oh.
there's not going to be so much criticism on a study at this point. But even anecdotally, you're not seeing too much of a change with these treatment modalities. Um, what about the testing? Governor Cuomo, he mentioned that testing has gone up, and that he has mentioned that there are some challenges in terms of the fact that there's so many different private manufacturers of these tests, and these testing labs are having a hard time getting the reagents for this test. So, like, all the different equipment for the tests. So do you find that testing is going up, or is it like plateauing now, your ability to do testing because of this logjam in terms of getting the proper materials for testing with the labs? Or what's your take? What's going on the ground there?
So at my facility, they develop their own test, and
Okay.
so we're not relying on the government testing that the governments are trying to arrange, because it's two different things. When this first started, there was an issue with testing. You probably it was in the media. So our
Yes.
facility decided to make its own test. So our turnaround time is in between 6 hours and 12 hours. We can have a test read. and testing is not difficult for our patients or ourselves. So I was tested last week on Friday because I thought I had some symptoms, and alhamdulillah I was negative. But
Okay.
I called into, the process for us is we call into a hotline. We tell them what our symptoms are, and then there's a doctor or another like a nurse practitioner or a physician assistant on the other line, and they go through an algorithm and they decide, oh wait, you meet criteria for testing or not. So I went and got a test. It took like I got an appointment, 30 minutes, took a test, came back and had my results in 12 hours.
So being a healthcare worker, are they only testing you if you feel that you may be coming down with something, or are they regularly testing you because you could be asymptomatic, right? And you're in a high risk zone. So what is the protocol for you as a healthcare worker?
So our facility protocol is symptomatic workers get tested first. That happened like, let's say 2 weeks ago. And then it went to asymptomatic workers that had been exposed to either the positive coworkers or positive patients without protective equipment. Then after that was asymptomatic but had worked in these units. And then it went down to asymptomatic but concerned.
Mm.
So they were even doing that, because I think the idea behind it as well, it will help us with epidemiologically after the fact when we realize how many people, as you mentioned, were positive but asymptomatic. And the other useful thing I think from that would be, there's a lot of this plasma donation and the use of plasma. So if somebody is positive, maybe they've developed antibodies, can donate plasma. That's actually one thing that I know studies has shown to be very positive, but not specifically with coronavirus. But I think they did that with SARS, and it was like 95% effective. So,
Oh, really?
So I think that's something. Medically and scientifically, it makes sense. So it's I can't speak on it for specifically coronavirus, but I know that it's very promising.
Okay. So now, if somebody does test positive, another point or a struggle that the governor was mentioning is trying to do contact tracing. It takes an incredible amount of resources, investigation to do that. Do you take part of that as being a healthcare worker to try to, or is there another team that works on, trying to trace everyone that an infected person was in contact with?
No, I'm not involved in that at all. Myself, or any of my colleagues, we don't have time to go chase down anyone.
Or like you don't do like a preliminary questionnaire at the facility, like, okay, who are you in contact with and whatnot? Do you like, I'm saying, do you play any role in that stage or in that process?
Of course. So it will be trying to get an idea of where they contracted it, but to that point, and then to be honest with you, I don't think there's anybody from the hospital. I think that's like supposed to be a government sort of mandated thing. I don't think the facility itself, I don't think we just have the resources to do that. We do, like, for example, somebody has coronavirus, we ask them, where do you think you most likely got it from? Believe it or not, a lot of people don't know, unless they had a positive family member already admitted. Those are the only people we know that we can trace them back to that one particular person. But then now getting to that person who might be admitted to another facility becomes even harder to ask them where maybe they got it from. The issue here is maybe the governor, I think maybe has talked about it before, is that there's really, in a privatized healthcare system, there's really not a lot of communication between different private hospitals. Okay. So there's just not a lot of information sharing. And so you could have one family member admitted to a different hospital, maybe another family member admitted to our hospital, but there couldn't be no information sharing. So you don't even know, in the way it's also negative, you don't know, maybe they're doing something that's working in their facility that we're not doing, or vice versa.
Okay.
And so it's a very disjointed system. I think my hope is, I think in Canada there'll be a bit more information sharing, since it's not privatized, it's not a for-profit system.
Yeah. There is a shared database here, which I think makes things a lot more synergistic in dealing with, patient care. So, is there any call right now? Then this is a perfect, I would say, impetus for some type of national database. For that. Because, for example, you don't have a lockdown between states, right? So people can go in between states. Mm-hmm. And from what I understand, they opened the beaches in Florida now. So they're trying to, certain states are starting to open. So now if you have people it could be very chaotic without, I would say, a level of some type of uniformity, either in tracking, either in policies. But it just seems like the instructions has been given, okay, governors will handle that however they see fit within their own state. And then you have also within that, as you're mentioning, a more privatized system. So is there any call for that? Is there any efforts towards making some type of database for information sharing?
Not that I've heard. I mean, not that it might not exist. It's not something that I've heard of directly. I think there's been calls for maybe like a more like a socialized healthcare system here due to this. Because I mean, really, the virus isn't differentiating between famous and not famous, rich and poor. Everybody is susceptible to the virus. So I think there's been a calls towards more of a socialized healthcare system, so everybody has a coverage, because it's the burden now. I mean, a lot of these for-profit hospitals now are forced to like use all these resources, and they're usually cutting very thin profit margins. So nowadays, a good chance a lot of these hospitals might go out of business, and that really should. When you're always a for-profit, if you're mixing healthcare and profits, and you're running like razor thin margins because there's executives and shareholders and stuff to pay, it's not going to be a good situation when a calamity hits.
Yeah, because I think you make a very valid point, because a for-profit model really works very well when you do have people suffering from different things. You know what I mean? So it works probably very beautifully, especially in terms of compensation schedules and so forth. But when you have so much of the population having to deal with the same thing, then, as you mentioned, it doesn't matter who you are. You could be somebody who's rich and famous, a celebrity, a politician, a person with a very, very simple job, and an unemployed person. Everybody is in the same boat. And if you don't treat the whole population, you're not really saving yourself. So if, for example, you're dealing with something you need a surgery for, you go in, you deal with that surgery, you're okay, it's fine. Because again, that's not something that can infect anyone. You're dealing with something for yourself. It's localized to yourself. But say you were able to get saved with, like, say you had coronavirus, you had a vaccine, you saved yourself. Bulk of the population still is dealing with that. It still will affect you because it can mutate. You can still get reinfected. We know that people take the flu vaccine every year. You can still get the flu, right? So I think something like this is like, okay, why should we have a universal healthcare system? Okay, pandemic, right?
Right. Yeah.
Oh, and it's not theoretical. It's not theoretical.
Right.
What I want to know actually is, so we get a good window. What's a typical day for you like? What's a typical day in the midst of all of this for you?
Okay, so I guess we can talk about, let's say, like an ICU shift. So what happens is, but we will talk about a little bit more background. So I'm a board certified internal medicine physician. I trained in Louisiana, actually, and then I came here for a fellowship. That's what I'm actually doing here, a fellowship. And initially, when this thing sort of started, nobody expected it to be the way it was. So first, to start off with, we've done a few things for COVID. We're going to be very careful about who we let in and out of the hospital, and only one visitor per family, and we'll screen them before they come in. All right, fine. And then it became, okay, well, slowly we've turned one of the wards into one of the floors into a COVID floor. We're like, all right, fine. Then it was like 2 days later, like, okay, the ICU is full of COVID patients now. Like, all right, well, now it's getting serious. And like 2 days later, it's like, okay, now we've turned this whole building into a COVID building now, like not just a floor. It's like now we've taken over the SICU, the surgery ICU. Now we've taken over the pediatric ICU. Now we've taken over the neuro ICU, and it just kept snowballing and snowballing. Initially, it was like a surprise, and it felt like everybody was stuck in mud or a little bit slow. But
Now,
once,
is there a mandate? I just wanted to ask at this point, is there a mandate for hospitals, whether they're private or not, to see COVID patients?
so there's an act called the EMTALA, Emergency Medical Services Act. It's called EMTALA. It's like a federal act where if you present to any emergency department in the United States with a life-threatening illness, you have to get treated regardless of finances or not. The hospital can pursue you after for repayment, but they have to treat you. And this happened after things. Now, it's very nice and pretty. Does it always happen that way? I don't know. Our hospital's great, but I can't speak for every hospital, but there is an act for this. So yes, if you get to the hospital, regardless of insurance or not, regardless if it's private or not, you will be treated for COVID, regardless if you're documented or undocumented, all this other stuff. Because I know there's fear out there. You hear it a lot in the US. It's a big deal being undocumented. So yeah, like everybody is by law supposed to get treatment.
Okay. And so that's maybe what also caused this to happen, right? Because they can't turn them away. They can't turn COVID patients away. They have to see them.
Right, of course. So yeah, so anyways, that's kind of how we, it kept snowballing. So initially, the idea was the COVID patients were going to be managed by our attending physicians at the hospital. And then it came to now, okay, our residents are going to manage them. And then it came to we need fellows to help manage, help cover ICUs at night. We're not forcing you guys, but we'd love for you to volunteer. Yeah. So it's appreciated. So, but at this point, like the truth is, at that point, I didn't, and we're not even at the point where they're forcing fellows to work. So the at this point, I was like, I think maybe this is the will of Allah subhanahu wa ta'ala, maybe it's a qadr of Allah subhanahu wa ta'ala to put me in a situation to work here. Yeah, I heard that there was pediatric residents that were volunteering in their ICUs to manage adult patients, which, I mean, for anybody who's been in the healthcare field, like, I can't imagine treating a pediatric patient. I just wouldn't know how. Even though you think they're little people, but they're not. They're so much more different. Yeah. And so I felt like, all these people are stepping up. I'm had some very good training in Louisiana. I felt like I had this, our critical care attending in Louisiana was this brother named Dr. Al-Abbasi, who was very, very tough on you. Like very, very tough. But if now, as now being in situations like this, I realize why, because he trained you really well to be ready for this. So then I said, at this point, I'm like volunteered, and I said, I'll help cover some ICU nights. So so now that brings us to today. What's the typical night like? So I show up around 7 p.m. At this point, one of the ICUs assigned out to me, and I work with the residents for all the admissions and evaluations and codes and rapid responses. So there are critical care fellows that are doing specifically critical care medicine. These guys are amazing. Imagine they're handling like 4 or 5 times many patients. Then there's a few of us fellows that are not from critical care, and each ICU has a resident intern, and of course a bunch of nurses. So throughout the night, what happens is we go and take our a stock of who our patients are, depending on which ICU we're assigned. We get 12 to 16 critically ill patients. So we kind of make sure everything's doing great at that point. Speak to the nurses, make sure the nurses are comfortable. So if there's anything they're concerned about, speak to the residents, and then kind of just starts the night. After that, you're waiting on calls from the ICU, calls from the emergency department for admissions, calls from because there's patients that are admitted that are not in the ICU as well, that aren't that bad, but they get bad.
What type of PPE are you wearing? Like, so you're going on your shift because you see various levels. Are you wearing the full bodysuit with just your face, and then you're covering it with the N95 and goggles? Like, what are you wearing on a typical day?
So I wish I was wearing that, but that's not what I'm wearing.
Yeah.
So
just
I'm wearing,
just a scarf over your head.
A red bandana.
A red, and a cowboy hat. A red bandana and a cowboy hat.
No, so what I'm wearing is I do get an N95, but it has to be reused. And once again, I think we were talking about this earlier. Before we would use a new N95. So an N95, a face shield. We're good with face shields. Like a surgical cap or a bouffant to cover my hair, and a plastic it's called an isolation gown, but for people that haven't seen it, what I would describe it as is it's like a cooking apron, right?
Like
It's
like what
not
a butcher maybe would wear. You know, they
correct.
have that kind of,
Exactly.
yeah.
Hmm.
Okay. So you're reusing the N95. How do you reuse an N95 mask?
So the idea is, so what we are given, this is at hospitals across the country, a paper bag. So you take it off and you put it in the paper bag, and then you carry the paper bag with you. And the idea being, whenever you need it, you put it back on. And it stems from the theory, once again, I don't know the data 100% behind it, that uh, if it's in a breathable sort of environment, I guess, or like because plastic would you know there would be no it would be kind of closed in. So the idea is that it would that the virus can't last as long because it's in a porous environment. So
Okay.
we carry that bag around. We carry every time we step out of a room. We take a shield. We wipe the shield with a solvent or like
Okay.
a wipe, and then we put it in a bag as well. And we carry those bags around to every consult and stuff like that. So that's what's going on. Ideally, I'd like to wear what you see in the news, where what they're using in like
Yeah.
Korea and China,
Yeah.
and the East, where they wear the full bunny suit or the Tyvek suits, with
Yeah.
the goggles and stuff like that. So, but in saying that, that's what's provided to us. What I actually do is I have my own goggles, and I have for demo for you guys. I have one of these. I use what's
Okay.
called a half mask respirator or an elastomeric mask.
Okay.
And the idea is that this filter, I don't use this particular one, otherwise I wouldn't be holding it. It'd be
Yeah.
contaminated. This is one I bought that ended up being counterfeit, so I figured it'd be good for demo. But yeah, yeah.
I see a lot of those being sold right now. eBay, Amazon, you
Hmm.
know, and a lot of them are coming out of, ironically enough, China and places like that. So
Yeah, so you got to be careful if anybody's interested in buying stuff like that. This one I got is definitely counterfeit. The reason I know is another brother who had a legitimate one. He
yeah.
sent it to me because he asked if I wanted this, and I said yes. They came around the same time, and I
Mm.
compared them. And this one, when you put a mask like this on, you do a negative pressure and a positive pressure test, and it fails both of them miserably. So
Okay.
you can't, in any good conscience, even trust the filters that come with it. But his mask was great, and I'm glad I used that. So I feel a little bit more protected, not having to reuse a week old N95.
Yeah. They accidentally sold me a 3N mask. I didn't look. It was it's 3N. It's 3N. N. You're supposed to sell me a 3M mask, you know. I'm sure people are making money, right? People like capitalize on situations like this. So you take that or so you have your own respirator then that you take.
Correct. Yeah.
Okay, so
Yeah.
you don't even use the one that they gave you, the N95.
Well, so the thing is, the respirator's a bit cumbersome. So
Yeah.
if we're going to be very specific, so if I'm at bedside doing a procedure, I'll wear the respirator. If I'm just going in to evaluate somebody quickly, I wear the N95 that we're provided, because like the actual filters themselves have a certain lifespan. They're
Yeah.
very hard to order now, so I can't just use it for like you know 12 hour full 12-hour shift and not expect to decrease the life of the actual filters themselves. So
Yeah.
we have to ration even the use of our filters.
Yeah, that's true. So okay, so now you're suited up. You're dealing with situations. So what are some of the um, I guess you could say the most intense situations that you would deal with in a day?
Oh, so I mean it's code blues. The issue we're having is a lot of people. The truth is, if we're finding that a lot of people that have code blues during this pandemic, it's hard because there's so many of them. First, just the amount. And the other issue with this is when you have a code blue, it's just what you see in the movies where somebody comes in, does CPR, and then you've watching like the TV shows where they come in, they clear, and they shock you and
Mm,
stuff like that. That's nobody actually does that. Like the shocking part, we have paddles, but
mm,
the CPR part, it's a super spreader event. So maybe I don't think the media is talking about it, but when you do the CPR, you're actually pumping on somebody's chest, and you actually take them off the ventilator if they're on a ventilator. If they're not on a
mm,
ventilator, you're bagging them or something.
Yeah.
Every time you push on their chest, you're causing virus particles to go out into the air, and you're literally infecting everybody in the room. And a code is run with like at least 6 to 10 people in there. There's multiple people trading off, doing CPR. There's 1 or 2 people doing the bagging, providing airway by holding the bag, the ambu bag, and 1 person holding the mask. There's 2 to 3 nurses in the room, either getting access or giving the medications that you're telling them to give. So that all these people are being infected during this time, and that's the craziest thing, because 1, you're putting yourself at the greatest risk at that time, and as well, that is the moment where either the patient will survive or not survive. That's the most critically ill moment, and realistically, you do the same thing every single time. It's an algorithm. There's nothing, just to be realistic about this. It's not like the movies we're doing. You're not house. You're not discovering something new at that moment. You're just following an algorithm. You see a rhythm on a monitor. You're just doing the next step, next step, next step. Depending on how old the patient is and how many comorbidities they have. And if you do not get return of spontaneous circulation, you decide when to call it, when we're done trying. Depending, if they're younger, you go longer. If they're not as young, a lot of comorbidities, you try your best for a certain period of time, because now you're risking everybody as well. Because every time let's say you get a nurse sick, a nurse manages 8 to 10 patients a shift. Per night on a 7-day week. That's 70 patients that aren't going to be seen by somebody, or you might have to get somebody to replace her. So you want to protect your the people that you work with as well, and the nurses and the assistants, everybody's they're just amazing, coming out and doing this, and it's
I've seen some reports that people from other parts of the country are also coming in to try to help. Do you see much people doing that where you're located?
Yeah, we have travel nurses and travel physicians here. Yeah.
Okay, so they've come in specifically to help.
Yeah. So what happens is in a regular hospital setting, we have an ICU. We have different ICUs, and we have ICU trained nurses, and they just cover those ICUs. And ICU nurses are like the top cream of the crop of nurses, or like trauma nurses. Like they're just they're amazing. So what happens is a hospital only has so many of them, and when you have to turn all these different units into ICUs. A lot of nurses are stepping up, but if they haven't been trained to do ICU stuff, they can't. You're compromising care at that point, and a lot of nurses can step up and do it. A lot of nurses have been doing amazing jobs, but there's also nurses that that are only maybe are surgical nurses that are only in the ORs just for surgeries. They're not used to doing regular, bedside care in patients. So you need nurses that have training, and those are the nurses that are showing up and doing the traveling nursing and stuff like that.
Yeah, and I think that's, again, in any tragedy, there's opportunities for people to really set a very good example, right? Like, I think this is what can really inspire people to emotionally, mentally get through this, is, some of what we set for each other as a tone, because I remember when this whole hoarding fiasco really took off, that has a very negative effect on the emotional state of everyone, But then when you see, okay, people are being unselfish, they're trying to contribute, they're sacrificing themselves, then it shows you the capability of humanity, the capacity that we have in terms of caring for one another in the face of adversity, in the face of death, at this time. You mentioned ventilators there. I just want to see, do you have enough ventilators, or is there a shortage of ventilators, or do you have now enough ventilators?
No, so alhamdulillah, we're good. Our hospital's good. We have enough ventilators. We received some from the national stockpile.
Okay.
And
I heard they're very beautiful ventilators. They're perfect. They're the most perfect, high quality ventilators. They're perfect. That's what I've been told.
They work.
And there's also companies, I believe, like automotive companies, who are repurposing their facilities to make ventilators. Have you seen that now into production?
No, not at all. I think by the time we'll get those vents, we won't need them. That's the truth.
Okay.
So I think,
Okay.
that's just it is. And I mean, in saying that, the national stockpile vents, they do work. They're not the newest, but right now, you really can't. You're just happy to have them, But they
Yeah.
look like something that came off a DeLorean. That's all I'm gonna say. And it's no joke.
Okay. All right. So it's not mechanical, right? You don't have to like somebody has to wind it up. It's
They are
still like,
analog. I'll say
yeah.
that. Yeah.
Yeah. Okay.
And
Okay.
and you take changes on them by using a rotary. For all the people that
Yeah.
don't know, back in the day, phones used to you have to turn. You have
Yeah.
to you have to do something like that.
Yeah. So I think this is a big wake up call. I probably for everything, stockpiles, like for absolutely everything. Now, what is the level of fear and anxiety on the ground? Because I was surprised to see that there's so many uh, voices for people to just start to reopen the economy or reopen, from the restrictions, businesses, etc., public gatherings. So there's this call to do that. Do you see that same call in New York, or maybe that's more relegated to other parts of the country, or maybe it's being blown out of proportion for politically for certain reasons? What do you see? Is there still that fear and anxiety, or is there now an itchingness to get things back to normal where you're located?
So where I'm at, it's a little bit harder to gauge when you're not going outside, right?
Yeah.
So, but I think the people here, they kind of realize. A lot of people know somebody that maybe had coronavirus or was infected by it. It's very obvious. There's images on the news and stuff of these these freezer trucks out with bodies. The morgues are overfilled. There's an island here for unclean bodies that people go in. They're buried there.
SubhanAllah.
So I think people know the population here, particularly in this area in New York, realizes the impact of it, and there hasn't been any of these. This is the epicenter, and it's part of the reason it's the epicenter is so congested. Everybody lives on top of each other. There's so much use of public transportation, and the amount the ability for it to spread is so much greater that I think nobody here is itching to do things. I think it's in more in the rural communities, and the truth is, like, having trained in Louisiana and having lived in rural America, I mean, I can understand that, right? Houses are farther apart. There's a lot of space. People there's little to no use of public transportation in some places. So they're thinking, like, what's my risk? Why can't I go and continue to work? And the way they're going about it is not very good, by essentially going and meeting in a public place and going and spreading the virus essentially among themselves. But you can understand where some people are coming from. I mean, in some communities, they could realistically probably reopen using PPE themselves as a community or as people and prevent transmission. The only problem being, I feel like, is that there's no uniform response here ever. You can just tell already the politicians aren't on the same page with each other. Hardly gonna be able to coordinate something like this. So I think that's you can you see where they're coming from. They want to be able to work so it's tough. But realistically, social distancing, that's what we need to do for a while.
Yeah. Have you seen any big tightening of basic supplies, or are you still able to get your basic necessities for you and your family?
Yeah, so when this first started, it was hard to get like toilet paper, I guess. And I'm just joking. We were okay with that, but like you have found there were issues with eggs. Eggs were hard to come by. Incidentally, like the price of eggs had skyrocketed.
Okay.
Milk was a little bit hard, but I think that was due to the hoarding. Since then, now the issue is because of these restrictions and limits on time when you go to the store, if you have time to go, and then what do you do? Like, are you going to wait in line? And then now they started this thing where if you show your hospital ID for healthcare workers, you can get out front and get.
Oh, okay.
Line. But then it's like, at least for me personally, like I feel bad. Like all these poor people who waited in line, I'm just jumping.
Yeah.
So,
Yeah.
alhamdulillah, the one good thing about being in New York is you can get a lot of delivery. So we've been good
Okay.
with delivery, but it is difficult. So before you could get a delivery, same day delivery. Now we're like delivering ordering like 2 weeks in advance to get food delivered. So
Okay.
that's the issue. The other issue is getting a lot of the smaller stores were just forced to shut down because they found, and more specifically, if I'm going to be more specific, in the from what I was told in the South Asian community, because they weren't keeping the South Asian stores and like ethnic stores, more specific, they weren't following a
Mm.
lot of protocols when it came to cleaning.
Okay.
So it's hard to. I think they were apparently, and this is what I was told, that they were closed so they could sanitize, and then they were enforced to follow you
Mm.
protocols and stuff.
Okay, I see. So, now, um, you know, we have a history of working together in the Dawah and the community. Have you any of your experience uh, with the Dawah? Have you found that to help you at all prepare for the struggle you're facing right now?
Oh yeah, alhamdulillah, for sure. I mean, so I feel like the one thing you get when you do dawah is that the idea behind dawah is you're going in. You trying to convince, like, the basic for me was always like trying to convince somebody of the beauty of Islam, right?
Mm.
And how amazing their religion is. And when you look throughout you look through, like, if you put yourself as an individual in whatever context, there's two ways to look at it. It's like, why am I stuck in this situation? Why I'm in this pandemic? Why did Allah do this to me? That, and then the other way to look at it is, this is I'm in this. Allah subhanahu wa ta'ala put me here in this situation, because that's what was the will of Allah subhanahu wa ta'ala. This is what I was meant to be here in this situation. What am I going to do in this situation? And that's something that I feel like you learn when you do dawah work, because when you do dawah work, it's an ever changing field. You're going out, and um, it's never the same. That was never the same as well. Like, you're always
Mm.
adapting situations. You're always thinking, why did Allah put me here? What's my purpose of being here? And what am I supposed to accomplish? So I think I think the other, so I think that's kind of, the basics of it. I felt like just the experience of doing dawah and always kind of being in a situation and being able to adapt, puts you, I think, to help just doing the dawah work itself, not counting the amount of, just the amount of, just the experience itself.
Yeah, because uh, because I know you personally, it's not like you were casually involved in the Dawah. We had some all-nighters. We had some times where, we're writing exams, we're putting on events, we're getting ready, like we're pulling an all-nighter. I don't know if you remember those late nights in the mix, and it's sometimes physically very demanding, mentally very demanding, emotionally, and it was no easy task for sure. And to be consistent on that, you really need to want to do it. You really need to have a strong why, and do you feel that purpose, like having always a higher sense of purpose, and in this sense, you're worshiping Allah by serving humanity, has that allowed you to stay consistent, like you're mentally, emotionally, what are you drawing upon to keep that even keel?
So I'm glad you brought that up, the consistency. So what this is a personal opinion. So for me, we know the life and death are given by Allah subhanahu wa ta'ala. And so that's what is the basis for me when I go to work and do anything. That this is because there's I guess in medicine there's this idea of a God complex you hear about, and stuff like that. Very negative thing, obviously.
Where
But
that's where doctors think that they're the ones, they themselves are saving people, and they're like a god, like I save lives, or
right, right,
and I
exactly.
can, if I wasn't there, the person would die, so to
Right,
speak.
exactly.
Yeah.
Let me tell you, in my experience on a side topic, there are times where there's no reason a person should have survived with something, and they're perfectly fine, and it's like mind-boggling. Like, how could this person have had this happen? There are times during my training, that there are things that shouldn't have happened to a patient and happened. It should have been detrimental and had made cause mortality, and it didn't happen. The person didn't die, and you're like, and at this moment you realize when all these, or there are times where you do everything perfect. I mean, you do the right thing, you get the right diagnosis, you start the right medications on time within what the guidelines say that you should do, and people don't survive. So there's no way that, and you realize like you don't control, or you have no control over this. I mean, this is something that as a Muslim, you're already aware that the control of life and death is in the hands of Allah subhanahu wa ta'ala. And Allah subhanahu wa ta'ala put this person to get better just through your care, but Allah subhanahu wa ta'ala put him there. Not you, he didn't randomly just arrive here. Allah subhanahu wa ta'ala put him here. If this person's meant to survive, this person will survive if you do the right thing, but only if Allah subhanahu wa ta'ala wants him to survive. No matter, because I've seen times where the wrong thing happened to the patient and they still survive. And how does that happen? So it's for sure. In regards to, sorry, go back to your question, the consistency. Yeah. So for me, the basis is in the health. My job is just to help them, provide the supportive care to get them through this. So realistically, I come home with a clean conscience every day, alhamdulillah. I remember the faces of all the patients that maybe have died under my care, but they don't, alhamdulillah, they don't haunt me, because I know that this is in the hands of Allah ta'ala, and Allah ta'ala is the one that decides life or death. So that's a personal way I handle the situation.
And what about because one of the things I find that the Dawah, it gives you very good communication skills, to deal with all sorts of different types of people. You deal with haters, right? People would deal with and usually that hate comes from fear, right? So you learn to deal with people who have a lot of fears, and then you deal with people in all sorts of different levels and states of understanding. So have you found that some of those communication skills have helped you in your field at this time?
Oh, alhamdulillah, for sure. So I think one of the great things of doing Dawah is the leadership skills you learn. And so what happens in the healthcare setting, as a physician, you're the leader on the healthcare team, and the healthcare team includes you, residents that work with you, interns that work with you, we don't have medical students in our facility right now, but medical students generally. You have your nurses, you have your nurse managers, you have respiratory therapists, you have just regular technicians, and they look to you for leadership. If you're and the skills you learn, I think one of the skills you learn in Dawah is to stay cool under pressure. You always stay, especially with the haters that you talk about, so staying cool under pressure. And when you're cool under pressure,
have you had anyone say to you question you whether you're Muslim and I don't want to be treated from a Muslim? Have you had that experience? Because I know some doctors have had that experience. That's what I'm asking.
Me personally, no, but when I was in training in Louisiana, there was a sister that wore a hijab, and she went to treat the patient, and the patient said she doesn't want to be treated by a Muslim, and so she wasn't treated. We had to switch her to a different provider. So yeah, it's something I've seen, but it's.
But I guarantee you, that when you're in an emergency situation, you're at death's door. They're not making that screening. They're not asking that question, right? They're not being like, they're like, Allahu Akbar, come on, treat me, come on, give me some hydroxychloroquine, give me something,
Right.
They're not going to be doing that, and you're there, you're not screening them. You're not saying, hey, what you're there, actually serving everyone, whether they're a hater or not. Even if you maybe saw that, person on TV hating, you would still treat them, because why? Why would you still treat them?
These are people Allah subhanahu wa ta'ala, right? Whether the way I feel like it, these are the people Allah subhanahu wa ta'ala. If you save one life, here's all humanity, right? So I would treat them, because these are the people Allah subhanahu wa ta'ala. If they hate me, that's not. I mean, you can't. I'm not going to react to ignorance, and so The funny part is the reason I was smiling earlier was incidentally that turns out that that patient got assigned to me that I told you about the sister. She got assigned to me in clinic. So she was my clinic patient for 2 years and she loved me. And
Yeah, and she didn't know you were Muslim.
oh, she knew. She asked
Oh,
me.
she.
She's like, "Where are you
Oh, she
from?"
asked.
So I said,
Yeah,
"Oh,
yeah,
I'm from Canada." And she's like, "Oh,
yeah,
you talk differently." I'm like, "Well, my parents are from Pakistan."
yeah,
And just like a bit of a look on her face. But I treated her very well. I didn't treat her any nicer than any of my patients.
yeah,
I just treated her, made sure she got better, and she loved me.
yeah.
She never had an epiphany or anything where she was like, "Oh, I changed my mind." But my job
Yeah.
was to provide her care, regardless of how she acted towards me. Whether she
Yeah.
chooses to follow my directions or not is her choice. So I was just going to provide her the same level of care, and we were fine.
Yeah, yeah. So, but she didn't request another transfer, right?
No, she didn't. No, she
It's like
didn't.
I keep getting these Muslims, you know. We just want to help you. We just want to make you better, so you can have a long life of like, hating us.
Right,
Yeah,
exactly.
yeah.
I
Yeah,
feel
I
like
think
killing one
again,
scientist.
you know what? I bet you deep down inside, like after being treated for 2 years by you, you develop an appreciation. I think a lot of the conceptions people have about Muslims is never based on direct contact with Muslims. Like vast majority of times, although Muslims aren't perfect, so I'm sure Muslims make mistakes, and then people will be like, oh man, I can't believe like I had this one Muslim guy who did this and this. So that probably does happen, but the vast majority of people who hate, they don't have direct communication. It's like I saw this on the media, like I saw this on YouTube, or I saw this in the media, I saw this somewhere else, but you never had that direct contact. So when you have this direct contact, it makes such a big, I think, difference, such a huge impact in people's lives.
Mm.
Especially in the profession that you're in, because you're in a profession that is vital for human function, for human care, and especially in this type of situation like you are in this pandemic. And do you find that uh, other doctors, do you see the mental toll that it's taken, and how do you see doctors in general reacting to this situation? Like, are there people who are becoming more introspective? Are there people who are being more religious? Are there people who are just starting to become more bitter? Like, what is the reaction amongst the medical workers dealing with this pandemic?
I think everything you described, I've seen. There's a wide range. I think people are handling it differently. I have seen some physicians panic and not wanting to have anything to do with the COVID patients and avoid it at all costs. And listen, there's a lot of legitimate reasons. They have young children at home, and they have maybe they live with their parents, and they don't want to put their parents at risk.
Yeah.
I have noticed people becoming a little bit more religious, but I think there's a lot of people that I feel like maybe I don't want to use the word demoralized, but it's become like a way of life, and you could kind of tell it weighs on their conscience a little bit. I think they're trying to stay upbeat, but I think a lot of them, I think I think it may be demoralizing for them just seeing the amount of mortality. Really, what we're seeing.
It's phenomenal. Like it can't, it has to have such a crushing weight on you to see all these bodies pile up. Even like, you probably have so many different hospitals, but to have that load where you're talking about 500 to 700 deaths a day, that's phenomenal. That's a phenomenal load to deal with.
Yeah, it's a lot. I mean, there's literally maybe like a freezer truck, maybe 100 feet, 150 feet from my house and from my front door, with bodies in there. And
Yeah.
so it's a lot. But I just go back and think this is, I think maybe this is just maybe not the appropriate look at it. But I feel like maybe this is for us, all of us, a reminder from Allah Subhanahu wa Taala that, I mean, imagine like we have all the technology, we can do whatever we want in the world, and then a virus hits, and then it throws everybody, every country, and all the people in that country just in disarray. And I think it's like a reminder to people that we don't have control. We don't have as a a people, or as humanity, don't have as much control over ourselves as we think we do. There is a higher power. Now, some people who are unable to see it clearly might call it nature, but we know that, that there's a will of Allah subhanahu wa ta'ala, and that there's something else that is that controls everything around us. That we don't have full control of our environment, and I think that's a good. I think if you kind of look at it that way, you kind of realize that it's not as.
And I think it puts so much of life into perspective. What's important, what's valuable, what deserves our attention. I don't think anybody who's in the same environment that you're in, dealing with these piles of dead bodies, so many people who are sick, they're thinking to themselves in the middle of the day, hey, I wonder what the Kardashians are doing right now. You know what I mean? Like, you understand what I'm saying? And it puts life into perspective, right? Maybe you're talking about yourself. What have I done with my life? And I really feel that, for humanity, they should appreciate the incalculable effect, not only for yourself, but all of humanity when you give. You know what I mean? Like at times like this, we have people in our lives that give to us all the time. We have teachers that give to us. Our parents have given to us. Our friends have given to us. Spouses have given to us. We have so many people in our lives that have given so much. The firefighters, police officers, like there's people who give, right? Who give, and people. There's levels of self-interest, but I think just appreciating the actual practical contribution to human life, this really refocuses the world. It kind of realigns that. Maybe we had this distorted, hazy picture of like looking at the world and what we gave attention to and all of these different things. Because right now, even though there's this impetus, okay, we need to restart the economy, the people who are in the middle of this, they're like, we need to save people. We need to, maybe even fundamentally restructure our system so that we can take care of people better. These are some questions that I think people would not ask if they weren't going through this pandemic, right? It would be business as usual. It would be, okay, we're just gonna keep going Monday to Friday, like the weeks passing us by. But every day it just seems different. Every week just seems different. And sometimes it can be very easy to get lost in statistics. Okay, the curve and this many people and this percentage and whatnot. But at the end of the day, real human beings are affected, who have feelings, who have people who count on them, who are trying to do the best that they can in this situation.
No, alhamdulillah, you're right. And the thing is, like, imagine you mentioned these people. Because of a strict visitor policies, people are dying without family members by their bedside. So imagine, the sort of the pain families and people are going through.
Yeah, I hope like regardless of borders, regardless of nationality, regardless of all these identifying markers that we do to separate humanity, I really hope that people go to a deeper understanding and a deeper level, going through this process, that we try to change the direction that our society has been headed. We were talking about Western society or modern society. I really hope we can do that for us as Muslims. And if I am sincere to my faith, I would say for humanity, is that to me, you turn to Allah, you turn to God, and you go to those fundamental truths that can benefit all human beings. Like universal things that, for example, the hadith of Rasul Sallallahu Alaihi Wasallam, want for mankind what you want for yourself. These are universal values that only seek to benefit each other, that only seek to help one another out, whether we're in a pandemic or whether we are outside of a pandemic, because we don't want to be in a situation, Ahmad. We saw 100 years ago the Spanish flu, right?
Mm-hmm.
Probably in recent for this scale worldwide, okay, to affect human beings globally. What happened after the Spanish flu? What are major world events that happened? So you had World War II. You know what I mean? So you had world wars around the same time, and you would hope that we would be more compassionate. The world would come together more. Everybody's affected. Like 1 in 3 people were infected with that virus. There was such a huge loss of life, anywhere between 50 to 100 million. They didn't even have ways of being able to officially track in a lot of areas the amount of loss of life. But we still go. Then what happened? We go into World War II. And then what happened after this Great War? Oh, we go into the Cold War. So you have war in Korea. You have wars in Vietnam, and then wars in the Middle East and Latin. Don't forget all the wars that happened in Latin America. Man, all of these different things, man. Like, I just hope that with we can take that reminder that let's maybe be a little bit more humble. As you were saying, like, it's very easy to develop that God complex. Maybe you can get that complex after the pandemic. Like, oh, I survived. I'm undefeatable. I was able to survive. Other people died, and instead of going through this process more humbled, you're more arrogant. You know what I mean?
No, you're right. I think if you don't come through this process realizing the fragile nature of your existence, and I think that maybe you've lost out a bigger lesson in this situation. So I agree with you 100%. Especially, I'm glad you brought up the Spanish flu. There's a thought with the way this is going that this could have a rebound effect on next fall. That's what they saw with Spanish flu, and they actually saw more deaths with Spanish flu in the fall. I'm saying that this could happen with the coronavirus itself. So it's something to, I think, I think this is something that's going to have a very long lasting effect on just global community as a whole.
Yeah. And I think that's what they're saying, is that there's going to be a rebound in the fall, and then these measures can be here for like a year, 2 years, in terms of generally social distancing, or fundamentally changing maybe how we interact with one another, at least more than just obviously it's in a heightened period of lockdown or a state of lockdown, but a lot of these general social distancing, or you'll see maybe much more common people wearing masks in public all the time for the foreseeable future. A lot of these measures could still be in place.
Yeah, no, I think so. I agree with you. And it's the other thing that you mentioned is, so in the hospital we have the massages here aren't doing Jummah right now. There's a ban on people getting together. I'm not sure what it's like in Canada.
It's the same thing here, yeah.
But alhamdulillah, so we have a prayer room, and we're able to have Jummah. There's 5 of us. So alhamdulillah, it's just for me, for myself, it's like it's like the Qadr of subhanahu wa ta'ala, like all these people aren't able to fulfill their Fard Jummah, Salatul Jummah, but we're able to get together and do it. So it gives, for me, it's like strength. Like, Allah subhanahu wa ta'ala is giving us this ability to fulfill our Fard. Like, all these people can't even do that, So it's those little things that you take.
Those Jummahs must be so much sweeter.
Oh yeah, because it's just because you know that there's nowhere else to go and have Jummah, so it's just it's awesome. And so yeah, it's and that's another thing, alhamdulillah, from just doing dawah work. You do dawah work, you learn a lot of skills, and being able to give khutbahs and stuff like that, or just having the ability, it helps, because it's not like a lot of people are available to do things like that. So it's just the backtracking as well, dawah work we did, just the things you learn always come back and help you fulfill.
You remember taking that fiqh of Jummah course?
That actually one of the brothers, when they are asking. So one of the things I learned from the fiqh of Jummah course is that you don't the one that, you shouldn't be pining to do the khutbahs. Like, if some, so
Yeah.
when they were having trouble finding khatib, that one thing, and the brother asked me, "Can you do khutbahs?" I was like, "Yeah, I can do some khutbahs." Like, "Oh, have you khutbahs before?" Like, "Yeah, I've done a fiqh of Jummah course." And he's like, "Why didn't you tell me this, brother?" I was like, "Man, I don't, if you when you needed me, you asked, and I said yes." So alhamdulillah, like, it was. I remember that course. It still comes in handy to this day, alhamdulillah.
So, subhanAllah, think about that. Like, how long ago did you take that course?
Like,
That must have,
I'm gonna say, like, we're maybe sitting at 10 years, maybe 9 years.
maybe more than that. Yeah, maybe 11 years. I don't know, maybe more. Yeah, it probably has to be a little bit more than that, maybe 11 or 12 years. I'm not sure. But think about it, subhanAllah, all that time, and you're still able to get reward, and everyone who took part in that is still able to take reward in that. And you would never have imagined that by taking that course, that one day people would be asking me in a pandemic, can I give a khutbah?
Yeah, that's not something you would think.
Yeah.
It's like, that's the amazing thing about when you do dawah work. All these things come back to you later that end up being beneficial to you. The experiences that you had, the situations you were put in. That's I think the greatest part about dawah work is just it's the work itself, but also the personal growth. Like, what you learn from doing dawah work is you want to always continue to improve. You will always continue to get better, and that's something that you carry through the rest of your outside of dawah work as well. You carry it because you have this. Okay, I need to improve. I need to get better. I need to. The other thing, the other amazing thing you learn from dawah work. I remember you mentioned this during a lot of courses, that it puts you out of your comfort zone. You end up doing things that you're not used to doing, or you've never done, so you're uncomfortable doing them. And there's a lot of that in even just in medicine. It's when you are learning a procedure, or you're learning, so it's uncomfortable to put yourself out there, or when you've never done something before, it's uncomfortable, or even being in a pandemic, but you get used to being in an uncomfortable situation because you know the overall benefit of it. You know that it'll lead to something positive, so you get more comfortable being uncomfortable, if that makes sense. So that's one thing you learn doing a lot of that work, that it becomes natural to you, to be able to deal with that,
Yeah, subhanAllah, that in and of itself is such a beautiful byproduct of being involved in dawah, because you're always being tested with what, as you said, you're comfortable with. You're always being tested. You're always being put in situations where you can grow. And if you look at the seerah of Rasul sallallahu alaihi wasallam, tell me a time when the Messenger of Allah sallallahu alaihi wasallam was comfortable chilling. From the day he was born, he was he was an orphan. He was struggling. There was financial struggles. He lived through war conditions in his teenager years. Every phase of his life, like, he went through some type of adversity, and at times where he could have just laid back. He's married. His wife owns a successful business. He still challenges the status quo. He still challenges what he sees as injustices in society. He still is able to challenge the system with the message of Allah subhanahu wa ta'ala. And that's our example. That's an example. That's a lifelong struggle of, as you said, being comfortable with discomfort. And the problem is that a lot of times people run away from being uncomfortable. People run away from that, and they don't realize that that's the opposite direction that you should be running. You should be running towards that, because that's where you grow. That's where you get true satisfaction. That's where you actually get a sense of strength. You know what I mean? Like, a person who goes through something strenuous, when they see other stressful things, like, for example, now, if you go through this pandemic, and may Allah subhanahu wa ta'ala protect you and your family, preserve you, so you come out of it with life and limb and increased iman. And so you come out of this. Now just imagine you're going to deal with just a regular day, in the ER, or just a regular day, like, and one code blue happens, or two code blue. It's like, man, I lived in a situation where I was dealing with, like, code blue all day. You know what I mean? Think about your mind, because especially when you're in that learning phase, people sometimes run away from hard cases or hard situation because they like freak out, panic. Okay, what am I gonna do? I don't want to look bad, or how do I deal with the situation? Like I want to ease into it. But now that you're going through this whole process, man, like imagine now the doctors that will come out of this, how they'll be able to deal with just a regular, what would normally be a hectic day.
No, that's very true. I think just for myself and for everyone else is kind of going through this. I think it's a good learning experience. I think there's a lot to learn from the healthcare system here, and I think everywhere with this disease itself, and about our protocols with pandemics. I mean, they're saying that with this increased globalization, increased travel, it's not surprising that this happened, and it's not unlikely that it could happen again in the future. So I think just doing that. I mean, and like you said, there's people that chose not to volunteer, not to work, or because it would make them uncomfortable, and they would learn nothing from the situation. So I definitely think it just the overall what's going to happen when inshallah this is over is we're going to have people will come out of this stronger. So
yeah. All right, brother. I really appreciate. I know you had a long shift. I can see on your face. It's been wearing physically. It obviously is quite daunting. So I really appreciate you taking the time, and I hope all our viewers can really benefit from your experience and some of the advices, and the whole idea of connecting with as many people during this pandemic is so that we don't just let this time pass. They're spreading around this phrase, "This too shall pass," but I'm hoping we're awake while it passes, and that we become stronger on the other side. So I really think that these types of reflections and interactions will hopefully help us get the most out of this situation. We want to maximize the benefit out of the situation. We all appreciate the work that you're doing in this epicenter that you found yourself in, and we hope that you can keep the Dawah strong as well, because I know for a fact that you have a strong legacy with the Dawah, and this is part of the Dawah, calling to the worship of Allah subhanahu wa ta'ala to ultimately benefit humanity in all shapes and sizes. So Jazakumullah khair, Dr. Ammad, for your contribution and the time you've spent with us today.
Thank you for having me. Thank you very much.
Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.
And to the rest of our viewers, Jazakumullah khair for tuning in. Life Haqq podcast. We're going strong. We want to try to bring you the Haqq. We want to try to live by the Haqq. And we will see you Thursday, 6 p.m. Mountain Standard Time, to bring you some more Life Haqq. We ask Allah subhanahu wa ta'ala to keep us steadfast on the truth and to protect us and our families. Assalamu alaikum wa rahmatullahi wa barakatuh.
Do I feel that the New York police are providing enough protection, or do I have to have protection of my own? I look for protection from Allah.